Did you know that poorly controlled allergies are a common cause of frequent sinus infections? Let me tell you about a patient I saw this afternoon that can help you understand why. This was a young man that was sent to me by his ear, nose, and throat specialist because he was getting frequent sinus infections, and no matter what medication he was taking, he was still getting infected and requiring multiple courses of antibiotics. His ENT doctor had done a thorough evaluation, including putting a scope inside his nose to look around, and he saw a lot of inflammation and suggested that the patient see an allergist. Therefore, he came to see me. On examination, of course, his nasal tissue was swollen, and the allergy testing showed that he was highly allergic to pollen in the air, as well as other things like dust and animals. I explained to him that the opening from the nose into the sinuses was very, very small, kind of like that, and that it didn't take a lot of swelling or mucus formation to clog up the opening of the sinuses. When that happened, bacteria or viruses that he breathed in the normal course of living his life got swept into the sinuses, but they couldn't get out. Therefore, they went forth and multiplied, and that resulted in the infection. In his case, we're going to make some changes to reduce exposure to things he's allergic to, and he's going to be starting a course of allergy immunotherapy, also called allergy shots, which will build up his immunity, help him become less allergic. And with less allergy, the odds are overwhelming that he will get sick a lot less. In fact, most patients that have recurrent sinus infections that go on immunotherapy tell me that within a year, not only do they feel better with regard to their day-to-day symptoms, but they tend to get sick a lot less, and when they do get sick, it's much less likely to require antibiotics. So if you're having recurrent sinus problems and you haven't been evaluated by an allergist, I suggest that you make an appointment, get tested, find out precisely what kind of allergy you have, and then discuss appropriate treatment options. Best wishes for your good health.